for CGH, I have around 120 to 150 admissions per month, of which 3/4 are preterms. How many incubators do I have? Around 10. How many babies require these incubators? 80. So how do we survive and help these babies survive? By controlling their temperatures. That's where now this skin to skin comes in very, very handy. They'll tell you that we've been saying, ukinyonyesha mtoto, eka kangaroo. So we are hoping that as a county, we are going to grow. Our neonatal mortality is still high, unacceptably high, because of the challenges we are facing. But we are hoping that we can capacity build our other level 4s so that we can decongest CGH. At the moment, I'm having 2 to 3 per incubator. Already I've broken the IPC protocols. But where do I send them? Where do I send them? And that's why, as a pediatric team with the support of the county health focal person, we've done a lot of mentorship to the sub-county hospitals. So my plea to the CHMT here is, can we capacity build the other sub-county hospitals so that the very sick come, we stabilize, we discharge downwards for continuation of care.
It is one of the indicators that we are struggling with as a county to improve on the neonatal indicators. As we've been told, it is one of the prematurity is one of the biggest challenges and one of the leading causes to neonatal mortalities. So whenever we try and see some of the children surviving, it gives us the hope and the courage to continue soldiering on.
In Kenya, the numbers stand at 15, worldwide, stands at 15 million, whereby Kenya takes 12%. This is quite a big number. It translates to approximately 193 babies who are premature. And the ones who survive should be quite a smaller figure. Comparably. If they meet the good Dr. Malangachi, then they survive.
It's one of our leading cause of morbidities and mortality, unfortunately, if not well managed. And the approach currently is to try as much as possible to reduce the number of children who are delivered preterm. And this is where the pediatricians cannot work alone without the obstetricians. And of course the midwives. We want to ensure that we do not have any child being born before term. But then there are other circumstances that can push us to have those small babies. So we usually want to ensure that we encourage our obstetricians who see these mothers first, so that we monitor them, we treat them very well to try and push this pregnancy towards term. And that should there be a reason as to why this baby should be delivered earlier than the term gestation, then we want to work very closely so that the pediatric team is looped in as early as possible to receive the babies and transition them to another life.
Kama hangekuwa hao madaktari, hatungekuwa na hao watoto. Licha ya kwamba hali ilikuwa ngumu hapa Kakamega. Uwezi kula mandazi, mzaa uwezi kuletea hata kasoda. Socha anakuamilia huko kwa gate. Ukichelewa kuja kunyonyesha mtoto, daktari anakuja mbio. Murambi ulikuja hapa kulala.
Daktari wote nawaambia ongera. Angekuwa ni nyinyi nilikapa around 3 months. Ningekuwa nishamwachia huyu mtoto nimetoroka nimeenda naye.
Mtoto kuzaliwa akawa ni premature. I thank this sister encourage more. Cause me nilikuwa nimesema sasa doli siwezi nikalea doli. After kulea watoto 3 wazuri, sasa 4 anakuja kama doli siwezi nikalea.
Hii nashika ni muujiza baada ya kuzaa watoto 3 normal. Na hii sikutarajia by the way. Kwa sababu nilikuwa na coil na nikapata nayo, kumaanisha kwamba Mungu alitaka mtoto asaliwe. Na narudishia Mungu baada ya kuzaa 1.2. Mtoto ndio huyu nilitoka, ndio huyu nalea. Na namrudishia tu Mungu shukrani na madaktari wa hapa.
Nilikaa hapa for 1 month. It wasn't an easy journey. It is not an easy journey. Wenye mko huko mjipe moyo. Just by seeing these kids here, tulikuwa tunaona wengine wamekuja clinic, ukiona mtoto wa mtu amepick, anakupea moyo like when will my kid get to this point?